Your hair does not collapse the day you stop hair loss medication, but the clock can start ticking. Hi, I'm Dr. Ko. I treat hair loss and perform hair transplant surgery. Today, let's answer one of the most common questions patients ask me. Do I have to take hair loss medication forever? And more importantly, what happens if I stop? Stopping medication usually does not make all your hair fall out overnight, but it can allow the original hair loss process to slowly return. That difference is very important. Finasteride and dutasteride reduce the effect of DHT, the hormone that can slowly shrink genetically sensitive hair follicles. When follicles become weaker, strong hairs can turn thinner, shorter, and eventually disappear. These medications help slow that process down. Minoxidil works differently. It helps support the growth phase of hair, so some hairs may grow thicker, longer, and stay active for longer. So hair loss medication is not a magic button that permanently saves your hair. It is more like a shield. While the shield is there, vulnerable follicles are better protected. When the shield is removed, the original hair loss pattern may gradually show again. That does not mean the medication damaged your hair. It usually means the medication was holding back the progression. Does hair fall out immediately after stopping? Usually, no. Hair grows in cycles: growth phase, transition phase, resting phase, and shedding phase. So, if you stop medication today, the hair growing today does not usually fall out tomorrow. The change usually happens over months. Think of it less like turning off a light switch and more like slowly dimming the lights. In the first 1 to 3 months, many people notice very little. The mirror may look the same. Shampoo shedding may feel similar. And this is when some people think, maybe I don't need the medication anymore. But this can be misleading. Under the scalp, DHT influence may be returning and the follicles may slowly become vulnerable again. From 3 to 6 months, some people begin to notice changes. More hair in the shower, less volume after blow drying, a crown that looks slightly more see-through, a hairline that separates more easily. The M-shaped corners may also feel weaker. From 6 to 12 months, the difference can become more obvious, especially if medication had been maintaining your hair well for years. Photos may show less crown density, thinner frontal coverage, or more recession. If I restart, can I recover? Sometimes, yes, but not always completely. If the follicles are still alive but weakened, restarting treatment may help them thicken again. But if the follicles have been miniaturizing for too long, the response can be limited. That is why timing matters so much. It is much easier to protect hair while it is still there than to bring it back after it has fully disappeared. I explain it like this. Hair loss medication is not a magic. It is more like a seatbelt. Taking off your seatbelt for a short time does not automatically cause an accident. But if you are driving through a dangerous road, wearing it is the safer choice. The first reason is side effect concern. Sexual side effects, mood changes, scalp irritation, unwanted facial hair, chest discomfort, or anxiety about long-term use can make people nervous. These concerns should not be ignored. But the answer is not always to suddenly quit by yourself. Sometimes we adjust the dose. Sometimes we change the medication. Sometimes we switch from oral to topical treatment. The second reason is I don't think it is working. But hair loss medication should not be judged after 1 or 2 months. In most cases, you need at least 6 months and ideally 12 months with consistent photos under the same lighting and angle. Also, success does not always mean dramatic regrowth. Sometimes success means your hair stopped getting worse. That is still a real result. The third reason is hair transplant surgery. Many patients ask, I had a transplant, so can I stop medication now? Not always. Transplanted hairs are usually more stable, but the native hairs around them may still be sensitive to hair loss. So if you stop medication after surgery, the transplanted hairs may stay, but the surrounding hairs may continue thinning. That can create gaps, uneven density, or a result that looked good at first but becomes less natural later. A hair transplant rebuilds structure. Medication protects the existing hair around that structure. Before stopping hair loss medication, ask yourself 3 questions. Number 1. Has my hair been stable for at least 6 months? Number 2. Why do I want to stop? Is it because of side effects, fear, pregnancy planning, health concerns, cost, or because I think I'm cured? Number 3. What is the backup plan? Dose adjustment, switching medication, topical treatment, PRP, scalp therapy, or a transplant plan may all be options. But stopping just because your hair looks fine now can be risky, because sometimes it looks fine because the medication is doing its job. Stopping hair loss medication usually does not destroy your hair overnight, but over several months the hair loss process can return. 1 to 3 months may look quiet. 3 to 6 months may bring more shedding and thinner volume. 6 to 12 months can reveal clear density loss. Restarting treatment may help, but it does not always guarantee a full return to the previous state. The best hair loss strategy is not panic, it is timing. Protect the hair while it is still protectable. If you're thinking about stopping finasteride, dutasteride, or minoxidil, do not decide based only on fear or one bad week of shedding. Take photos, compare properly, and speak with a doctor who can evaluate your current hair condition.